Welcome to the last part of this lecture series on psychosocial skills. Here we will examine imagery and relaxation strategies. First, let's take a look at different imagery tools, including soothing imagery, healing imagery, performance imagery, and other types of imagery. What is imagery? Imagery is visualization, mental rehearsal, symbolic rehearsal, or mental practice that occurs in the mind. It's creating or recreating an experience in the mind. Imagery is recalling from memory pieces of information stored from experience and shaping them into meaningful images in your mind. It's a form of simulation similar to a real sensory experience, such as seeing, feeling, or hearing, but the entire experience occurs in the mind. There are two types of imagery perspectives. The first is internal imagery, and this is where an individual imagines the execution of a skill from his or her own vantage point. It's as if you have a camera on your head and you're looking from the first-person perspective. For example, in the picture to the left, this is internal imagery in which you might be looking down at the ball as you swing or set up for a golf swing. External imagery is viewing yourself from the perspective of an outside observer. It's as if you're watching yourself in a movie. For example, seeing yourself from the sideline get past an opponent and score a touchdown. Let's take a look at different types of imagery. First, we'll explore soothing imagery. Soothing imagery is when you have individuals use images they feel is their quote-unquote happy place. This might be a beach, warm weather, in nature, with family, or any place that an individual feels soothed by. A person should imagine themselves in this environment through the soothing imagery process. And ideally, in all types of imagery, all senses will be used. So let's give this a try. In order for imagery to be successful, you should be in an area that's not distracting. So if you're watching this lecture right now in a crowded or busy place, you can pause and move to a more quiet, secluded area, or you could come back to this part of the lecture when you're in a more private location. Ideally, you won't be distracted by other things like music or a TV, so go ahead and turn those things off if they're on. Pause the video if you need some time to get set up. Once you're ready, get in a comfortable position and close your eyes. Listen to the words that I say as I go through this imagery script and try to imagine in your mind exactly what I'm picturing or what I'm describing to you, as well as the other senses. Let's get started. Imagine you're sitting in a chair on a beach with the clear blue ocean in front of you. The weather is warm, but it's not too hot, and you can feel the sun on your face as you stare out the sea. You hear the waves peacefully crashing to the shore. You can feel your feet in the warm sand as you dig them further and deeper until they're covered by the sand. You taste the salty air, and you can also smell the crisp ocean breeze. You can feel it blowing past you. The only thing you can think about is how breathtaking the never-ending view of this ocean in front of you is. Go ahead and open your eyes and pause the video. Take a minute to answer the question on your worksheet about this imagery experience. Healing imagery is another type of imagery that can be used in a healthcare field. Healing imagery is used to visualize the internal processes and anatomical or physical healing that takes place during treatment and rehabilitation. An example might be imagining a fractured bone healing together. And you should provide knowledge of the treatment or rehabilitation as to what's actually happening physically in order to have the individual, so the athlete or the patient, imagine internally that process occurring. So maybe for a fractured bone, You might describe to them the healing process, and they can imagine the bone cells healing within their fractured bone. Pain management imagery includes a few different types of imagery, and the goal of this type of imagery is to help reduce pain. Pleasant imaging is very similar to soothing imagery. It helps to disassociate pain. For example, you might see yourself lying in the grass, free from pain, and experiencing that scenario without pain being a part of your life. Pain association imagery is when an individual should see the pain as a physical property improving. So, for example, an individual might imagine a painful area as the color red, and then they'll imagine it turning lighter and maybe a soft blue tone as it becomes less painful. Dramatized coping is another type of imagery in which an individual will see the pain as a part of a challenge to overcome, and maybe even use this as a motivational tool. For example, this pain may be holding you back, so imagine yourself getting through this rehabilitation exercise to overcome it and get past the pain. Rehabilitation rehearsal imagery is when an individual or patient can rehearse the rehabilitation process or specific exercises in their mind. The goal is to maintain or regain focus on rehabilitation and also cope with challenges and setbacks. So, for example, an athlete might see themselves completing a required exercise they've previously had trouble completing. And so maybe they'll complete rehabilitation rehearsal imagery before doing that specific exercise. This may help reduce anxiety about the exercise because they've already gone through the exercise in their mind. And performance imagery can help individuals or athletes improve performance. It can also help injured athletes return to play after injury, so it could give them the confidence to return to sport. So, for example, performance and imagery can be used to instruct athletes, so to rehearse specific sport skills, or to motivate them. So, injured athletes can visualize themselves back on the field and performing injury-free, as if the injury never happened. This can help reduce anxiety and help mend the way from the athlete who's injured to get them back on the field performing in their sport. Let's switch gears to relaxation strategies. Here we'll talk about a handful of different relaxation strategies that can be used in all aspects of life, whether you're an athlete or not. We, ourselves, athletes, patients, etc., can use psychosocial relaxation or energizing. Either one would be considered arousal control. And these techniques can be used to reach optimal levels of arousal, whether that is to be relaxed or to be energized. Psychological distress can be manifested both cognitively in the mind and somatically in the body. Individuals need tools that will help both mental and physical aspects of psychosocial distress. Even with one, however, the other is affected. So, for example, when the mind is affected, the body, therefore, will be affected. And when the body is affected negatively, then the mind may be affected. An example here would be reducing cognitive anxiety may release physical tension that you're feeling, maybe in your shoulders or in spasm of your muscles. By reducing this physical tension, it may also lessen cognitive anxiety. This is very similar to the pain spasm cycle if you've learned about that before. There are two types of relaxation techniques, muscle to mind and mind to muscle. Muscle to mind relaxation techniques focuses on the physical or on the muscle, and therefore it subsequently relaxes the mind and relaxes the muscle. Mind to muscle techniques focus on the mind specifically. And subsequently, by relaxing and focusing on the mind, it will relax the muscle. First, we're going to explore deep breathing techniques. Deep breathing is a muscle-to-mind technique in which we're focused on the physical, so the actual physical task of breathing, and therefore relaxing the mind. Proper breathing comes from the diaphragm. This is a thin muscle that separates the lung and abdominal cavities. So let's try a full breath. First, you're going to start by forcefully exhaling. Breathe out. You're going to do a deep inhalation using a long, slow, deep inhalation through your nose, and then a slow, controlled exhalation out. You're going to pull your belly in to push out the last bit of air. That forceful exhalation at the end. Directly after the air is fully exhaled, you will feel a still, quiet, calm, brief moment before your next breath in. This is the complete breath cycle. Pause the video and try 10 deep breathing exercises. Again, you're going to start and begin with a forceful exhale, blowing out. Deeply inhale through your nose, as deep as you can, and then very slowly control your exhalation. You will feel that pause at the end of exhalation, and then start the inhalation again. Try 10 of these. We want to make sure that you're actually breathing from your diaphragm. And to make sure that you're controlling your breath from the diaphragm and not from your upper chest, so when you're inhaling, you shouldn't be inhaling through your mouth, and your chest shouldn't rise. Here's a test to see if you're doing it right. Put one hand on your abdomen, so on your stomach, and the other hand on your upper chest. If you're taking a deep, complete breath from the diaphragm, the hand on your abdomen will move out. So the hand on your stomach will move out with inhalation and with exhalation. But the hand on your chest should remain relatively still. If the hand on your chest is moving, it means that you're breathing from your upper chest and not from your diaphragm. In order to have successful relaxation, you want to breathe from your diaphragm, the muscle in your stomach. There are tons of different deep breathing types of exercises, and here we'll go through a couple of them. Sighing with exhalation is a common type of deep breathing exercise that athletes may utilize. It means actually exhaling and having a sigh with it, such as, This aids in reducing tension. It allows you to let your mind go and let the thoughts go with your breath. Rhythmic breathing is when you might inhale to a count of 4, hold for 4, exhale for a count of 4, and then pause for a count of 4. And it could be ideally any number. There's also a 1-to-2 ratio of deep breathing exercise. So this might be counting to 4 of an inhalation and then counting to 8 for exhalation, or you could do 5 to 10 or 6 to 2. The 5 to 1 count deep breathing exercise is when you self-talk, counting down from 5 with each breath. So you might inhale 1, 2, 3, 4, 5, and then exhale. And then inhale and count down or upwards from 5. And then concentration breathing is when you focus all of your attention on your breaths. You hear the breaths come in and you hear the breaths come out. Maybe you're also sighing with exhalation and you're actually focused on the breaths. This will help you concentrate on the task at hand. Progressive muscular relaxation is also a muscle-to-mind relaxation technique. Progressive relaxation, also known as progressive muscular relaxation in the literature, is a series of exercises of contracting a specific muscle group, so for example, your quadriceps or thigh muscles, holding the contraction and then relaxing. Ideally, you will progress from one muscle group to another. This teaches awareness of tension and relaxation. The idea behind progressive muscular relaxation is that you get a feel for what tension really feels like and what relaxation really feels like. The different types of progressive relaxation include active, differential, and passive. Active progressive relaxation is an all-out contraction of muscle groups in which you hold and contract all of your muscle groups and relax them all at the same time. Differential progressive relaxation is initially an all-out contraction and relaxation. Then you move to half as much tension, so a 50% contraction and relaxation, and then move to minimal tension, so slight contraction and relaxation of the different muscle groups. Here you can recognize and release tension of different intensities. And passive progressive relaxation is when you will relax the muscles first without tensing them at all. But in order to do this, you need to be able to recognize tension. This is the ultimate goal in progressive relaxation, in which an individual can maybe feel tension, let's say in their trapezius or their upper neck muscle, and recognize that there's tension in their neck, maybe close their eyes, take a deep breath, and actually focus on having the muscle relax. Ideally, this is the step or goal that someone who's been practicing progressive relaxation will get to, so that you don't actually even have to contract your muscles in order to then relax them. You'll be able to think it in your head and have them relax. Now let's switch to some mind-to-muscle relaxation techniques, such as meditation. Meditation is a technique or practice in which an individual trains the mind to go to a specific state of consciousness. It's relaxation, mindfulness, awareness, etc. Mindfulness meditation is being in the moment, aware of the moment, and being okay with the moment, being in the present. This can also include repeating mantras and deep breathing through meditation. Meditation has been used by many elite athletes. And lastly, let's discuss reframing. This is also a mind-to-muscle relaxation technique. Reframing is changing or reframing the way in which an individual perceives or appraises a particular situation or event. So, for example, an athlete might believe that rehabilitation is wasted time away from sport. And therefore, ideally, they would reframe their thinking to rehabilitation is a good opportunity to focus on building my strength and for me to become better at my sport. By reframing, you're taking anxiety-producing thoughts, such as, rehab's wasting my time, and now I'm spending too much time away from my sport. And by reframing them in a more positive light, ideally, the individual would relax from the new, changed thought. So let's wrap up. You are now done with the 3-part series on psychosocial skills. Finish your ticket-in worksheet and bring this to class as we will continue these activities.